Hey everybody, welcome back. And boy, have I missed you all. It has been a busy summer, but anyway, I am here. We're going to have a CNA knowledge check. We're going to prepare you for those CNA examinations. And as we do in each of our videos, we're going to give you about 10 seconds to receive your notifications and we will get started shortly. Good morning, everybody. I hope you are having a phenomenal day and an amazing week. And so let's get ready for today's practice test. I am here to help build your confidence. If you don't know who I am, my name is Eunice. I go by Nurse Eunice because you all gave me that name and I absolutely love it. So before we begin, please find a quiet space so you can focus. Have paper, pen, just something so you can jot down some notes. We're going to review medical terminology, vital signs. We have a lot to cover today. We have 40 questions. Read each question carefully and then trust your instincts. You already have the heart for patient care. We just need to help you get certified. So that's what we're going to do today. We're going to help you pass the examinations and be the best caregiver that you can be. And so I see everyone saying hello, hello, hello. I'm so happy that you're passing your exams. You all make me and my team so proud. You all are some of the best viewers ever. If you haven't done so, go to nurseeunice.com, scroll towards the bottom. You're going to see free printable practice tests. That's right. So it's a lot of information there. There are study guides, a lot of information, you all. We add value and we do most of it for free. And so if you do feel like supporting, there are $5 bundles that you can purchase that just helps support me and my team. It buys coffee. It maybe treats us out to lunch every now and then, but we do value you. And if you go all the way to the bottom, nurseeunice.com, look for those printable practice tests. That way you can have something that you can print in addition to watching our videos online during the live streams. You all, we are so close to having 1 million subscribers. Who would have thought? We're probably going to reach that goal within the next week. And so I just want to thank you all so much for being, so wonderful and subscribing to our channel. If you haven't done so, hey, make it official. Join the Nurse Eunice family, the Florida Training Academy family. Plus, our family is expanding. We're hiring a new nurse who's going to come on to help with NCLEX prep. And there's a CNA, a seasoned CNA, who's going to help and come on and do translation, who's going to help translate our videos into Spanish. So there's a lot here. We are growing and I want you to grow with us. And so if you find value, go ahead and like the video and the other videos that you've watched. It doesn't make any sense for you to be watching the video and not letting the algorithm, not letting YouTube or Facebook know that you're enjoying the content. And then don't forget to share. You all, I know that schools nationwide and globally use my videos to help their students pass. And so if you're an educator who's watching with your team, with your class, hello, and we appreciate you also. All right, let's get started. Question 1. What is the normal adult range for an oral temperature in Fahrenheit? Is it A, 96 to 97 degrees Fahrenheit? Is it B, 97.6 up to 99.6 degrees Fahrenheit? Is it C, 100 up to 101.5 degrees Fahrenheit? Or is it D, 98.6 up to 100.6 degrees Fahrenheit? And I know for a lot of you all, you know textbook normals. Your patients usually don't present as whatever the normal is in the textbook. So we have to give them a range. And so for the range for an oral temperature in an adult, if you chose B, you are right. It is 97.6 up to 99.6. Some textbooks may vary slightly, but it's not going to be much further beyond that. And so why 97.6? Because here in America, all of our offices, all of the hospitals, they have air conditioning. And so usually our patients are always cold. Their temperature's not going to be 98.4 because they're in the room freezing. They're asking you for extra blankets. And so our patients, if you really check your patients' temperatures, you're going to see are usually around 97.8, 98 degrees versus in another country where they don't have air conditioning, their patients' temperatures are going to be higher. So whenever you're thinking about the ranges, don't just think about United States standards. Think about other parts of the world. that may not have all of the conveniences that America has. And so that's why your patients have a range. It's based upon their culture, where they live, and everyone isn't going to be textbook. However, if your patient's temperature falls outside of this range, let your nurse be made aware, because it could be that they may have a fever or that they may be hypothermic. And so you still have to let your nurse be made aware. But the point is, everyone's temperature will not be 98.4. Question 2. Which pulse site is most commonly used to assess heart rate in an adult? Is it A, brachial, B, femoral, C, carotid, or D, radial? Yep, I missed you all. I missed you all. Been trying to get back online. It's been really busy. All right, and so for question 2, if you chose D, you understand that the radial pulse located in the wrist at the base of the thumb, the radial pulse is the easiest and most accessible site for assessing heart rates in adults during routine checks. So if you're just coming in to do your Q4, your Q8, whatever the vital sign setting is, you would be feeling for the radial pulse as long as your patient's talking to you, the radial pulse. All right. And so question 3. How long should you count a patient's pulse for the most accurate measurement? Would it be A, 15 seconds, B, 30 seconds, C, 45 seconds, or D, 60 seconds? All right, I see a lot of answers. Great job, team. If you chose D, you understand that counting the pulse for a full 60 seconds provides the most accurate measurement, especially if the rhythm is irregular. So if it's irregular and you count it for 15 seconds and then you multiply that number by 4, you gave me a number that was based off of an irregular rhythm. So that means that you really didn't count for a full minute. Maybe after a few, we will call them like PVCs, or just these abnormal beats that a patient can have, their heart rate returned to normal. So it's just best for you to count for one full minute. Plus, during your test, you have to count for one full minute. And so those simpler ways that you learn when you're on the field, when you're out working in the facility, when you're in the facility, you can sometimes do what you want to do because there is no oversight. However, when you're at that test, you need to do things the right way, which means that you have to count for 60 seconds. And in the real world, that also helps to ensure that you're given the best vital sign measurements for your patients. Question 4. Think about those prefixes that I've taught you before. What is asystole? Is it A slow heart rate below 60 beats per minute, B, a rapid heart rate above 100 beats per minute, C, no electrical activity in the heart, or D, an irregular heart rhythm? What is asystole? All right. I'm not going to move a little bit faster because I do have an appointment, and so I gotta, shoot this video and make it to my appointment on time. So the answer to question 4 is going to be C. So whenever you have the prefix A in front of a word, it means the absence or the lack of. So asystole is the flat line. You all get to that room right away. It could be that your patient's in cardiac arrest. Well, how would you know? You have 10 seconds to feel for a pulse and check for breathing. The monitor shows a flat line. Your patient is unresponsive. You check the carotid pulse. You look for breathing for 10 seconds. They don't have either. You reach over, you hit that code button, you start your CPR. And of course, you're going to call out for AED. But sometimes if your patient's leads come off, the machine will also go flatline. Regardless, if you see this on the monitor, you get into your patient's room right away, because this usually represents a medical emergency that is often fatal. Question 5. What is the term for an irregular heartbeat? Ooh, all of those terms I taught you. Is it A, tachycardia, B, bradycardia, C, arrhythmia, or D, hypertension? So think of those terms I taught you: tachy, Brady, hyper, those prefixes. They all mean something. And for 5, if you chose C, you understand that arrhythmia is the lack of a rhythm. Remember, the A stands for the lack of. So arrhythmia refers to an irregular rhythm of the heartbeat, which can be caused by various factors. So whenever you notice something that's wrong, you're going to let your nurse be made aware. Question 6. Which tool is used to measure oxygen saturation in the blood? Is it A, sphygmomanometer, B, pulse oximeter, C, thermometer, or D, stethoscope? All right. Which tool is used to measure oxygen saturation? And if you chose B, pulse ox, you are right. Correct. Great job, team. And so for short, we call it a pulse ox. But a pulse ox is a non-invasive device that measures the oxygen saturation in the blood. As a reminder, when you're putting a pulse ox on the patient's hands, if their hands are cold to touch, if they have fingernail polish on, if they are dark skinned, evidence-based research has showed that the pulse oximeters, they don't read well on African Americans or dark skinned individuals. So regardless of what that machine says, that device says, if you feel like your patient isn't presenting well, get your nurse into the room. So what would the nurse do? The nurse would use her stethoscope. She would do an assessment. She would call the doctor to get an arterial blood gas ordered. And so that way, instead of getting a reading off of a finger, we would be able to get reading from their actual blood. Okay. And so there are ways to help your patients. We just need you to let that nurse be made aware. Question 7. A patient with a respiratory rate of 8 breaths per minute is experiencing, is it A, hypoventilation, B, hyperventilation, C, the E is silent, so eupnea, or D, tachypnea? If your patient has a respiratory rate of 8, I know, new term. It's not C. C actually means normal. So the that means normal. All right. And so it is going to be A. That is right. So hypoventilation refers to a respiratory rate that is slower than normal, potentially leading to inadequate oxygen intake. Question 8. When measuring blood pressure, the first sound heard through the stethoscope represents, is it A, diastolic blood pressure, B, the pulse pressure, C, the systolic blood pressure, or D, the mean arterial pressure? So many great responses. And yes, it is C, you all. It is a systolic pressure. Here's the rationale. The systolic pressure is the first sound heard when measuring the blood pressure, indicating the pressure in the arteries during the heart's contraction. And so the diastolic pressure is when the heart would be resting. If you want to learn how to read the blood pressure cuff, most of your problem is that you don't know how to work the manual blood pressure cuff. You don't know how to read the gauge. So what you would do is you would open up your camera app on your phone. You would just hover, and then a link will appear. You're not taking a photo. Open up your camera app. It will start scanning that QR code. Click on that link. It's going to take you to a video that shows you how to read the gauge on the blood pressure cuff. And then the second video that it's going to lead you to is going to show you how to actually perform the blood pressure. You can be the best at performing, letting out the air. But if you don't know how to read it, that means that you're going to be providing inaccurate blood pressure readings. That could be a danger to your patient. So learn the skill. If you don't know how to do it, of course, everyone can't come here to Jacksonville. But if you don't know how to do it, just ask a nursing student to help you, okay? Question 9. Which of the following may cause tachycardia? Is it A, sleeping, B, dehydration, C, cold exposure, or D, beta blocker medications? Which may cause tachycardia? Okay, so first you have to know what tachycardia means. When you take your test, it's not going to be giving you the explanation for your medical terms. You have to know your medical terms. And so on our website, we do have a medical terminology flashcard set. So whenever you go to nurseeunice.com, or if you go to our main website, which is fltraining.com, you click on resources. From resources, it'll take you to study guides and more. I need for you to understand your medical terms. Sometimes when you're not passing these exams, it's not because you don't know the material, you don't know what to do in the real world. It's because you don't know what these terms mean. And so as a CNA, you have to know medical terminology, because you would understand that dehydration, the lack of volume within the body, causes tachycardia. Why does it do that? Because the body's like, hey, you know what? My hands represent the heart. So it's pumping, pumping, pumping. And it's like, you know what? The pressures are too low. We don't have enough volume. So let me go ahead and pump faster to try to pump more blood through to circulate, to make sure that they have enough oxygenated blood to the brain. We call that compensation. And so the heart tries to compensate for the lack of blood flow by beating faster to help maintain circulation. So when we ask that you push fluids, when we say, hey, I need for you to make sure that Miss Lucas drinks a cup of water with every meal, etc., your job as a CNA is to actually do that, because we know what's going to happen when they get dehydrated, including UTIs, that it can cause cardiac issues too. Okay, so you do what you're supposed to do so that the heart can do what it does, which is circulate the volume, but it needs you to give your patients water in order to do so. All right, question 10. What is the normal range for oxygen saturation in a healthy adult? Is it A, 85 to 90%? Is it B, 90 to 94%? Is it C, 92 to 96%? Or is it D, 95 to 100%? All right, and thank you all for letting us know that you have passed your exams. Again, we are so proud of you. We receive so many messages. You all are so encouraging, and you help us do what help us to continue to do what we do, which is to come on here to help you pass your examinations. And so for question 10, yes, the correct response is D, 95 to 100%. So normal oxygen saturation levels, again, are between 95 to 100. If it's a lower than 95, that may indicate hypoxemia. The reason why we say may indicate is because those who may have COPD or emphysema, they thrive. They need a lower oxygen level. So if you see a patient who's hovering around 92%, they appear fine in their room, and you're like, hey, Nurse Eunice, why aren't you freaking out? Because according to textbook, we should be freaking out. If you ask your nurse at the right time, not of course while he or she is extremely busy, they will explain this to you. Most nurses love helping their CNAs grow. And so 95 up to 100% is normal for those who do not have underlying respiratory conditions such as COPD or emphysema. If your patient came in and they did not have a respiratory diagnosis whatsoever, when those SATs are getting closer to 95%, get your nurse in there right away. Question 11. A CNA notices that a patient's heart rate is 52 and that BPM, when it refers to heart rate, is beats per minute. If it's BPM related to the respiratory rate, that would be breaths per minute. So I'm going to repeat that. A CNA notice a patient's heart rate is 52 BPMs or beats per minute. What is this called? Is it A, tachycardia, B, asystole, C, bradycardia, or D, arrhythmia? Revealing the answer in 3, 2, and yes, it is C. It is bradycardia. And you're like, well, Eunice, bradycardia is an arrhythmia. And when you think of arrhythmia, think of somebody who's dancing off beat. So the music's going one way, but they're doing the robot. So Brady, because it's slow, it can be slow yet still normal. It can be slow and regular versus irregular. So bradycardia is a heart rate below 60 beats per minute. And I love this image. I created it. Hey, it shows the heart moving really slow because it's on top of a turtle. So anytime you think of bradycardia, I want you to think of that turtle. It's moving way too slow. That means that the heart is not beating fast enough to circulate a sufficient volume of blood. So that means your patient's blood pressure could be low. If the pressures are low, remember the oxygen is attached to the blood. So if the pressures are low, that means that their O2 sat could be low too. So all of those vital signs, everything works together to help ensure that your patients are stable. And that's the goal. If they are stable, they're going to get better and they're going to be discharged home. If they're unstable, that's when they can start having those additional cardiac and respiratory emergencies that could lead to CPR, cardiac arrest, respiratory arrest, etc. Question 12. What condition could cause a heart rate of 120? What does the BPM stand for, you all, related to heart rate? So I'm going to repeat it. What condition could cause a heart rate of 120 beats per minute at rest? Is it A, deep sleep? They must be having a nightmare. Is it B, shock? Is it C, hypothermia? Or is it D, well-trained athlete? All right, reveal an answer in 3, 2, and yes, it is B, you all. So in the organs, whenever the body goes into shock, there is reduced blood flow to the organs. And so remember, the heart tries to compensate. So it tries to start beating faster. And so that's why you're oftentimes, whenever a patient is in shock, that is a medical emergency, the rapid response team is going to be in the room. So you as a CNA, you may be running back and forth to get supplies. So shock is a medical emergency. And there are many different reasons for shock. It could be hypovolemic. It could be septic shock. As a CNA, you don't have to know all that. We just need you to know that when your patient's vital signs are abnormal, get that nurse into the room so that he or she can assess that patient. 13, when taking an adult's blood pressure, the cuff should be placed where? Is it A, on the upper arm over clothing, B, on the forearm directly on the skin, C, on the upper arm above an IV site, or D, on the upper arm directly on skin? And I'll give you a few seconds to read through that. All right, I see mixed answers. You're never going to put a blood pressure cuff directly above an IV because whenever that cuff gets tight, it's going to push that IV out. Your nurse and your patient are going to be so ticked at you because now the nurse has to go back and do more work, but the patient has to get stuck again. So you're going to do D. It's going to be on the upper arm directly on skin. I'm going to talk about best practice versus real world. Remember, your patients are not textbooks. And so the blood pressure cuff must be placed directly on bare skin, not over clothing, to ensure accurate readings. Well, if I have a patient who's crying, who's apprehensive because the blood pressure cuff hurts their arm, and the only thing they say is, hey, take the blood pressure over my sleeve. You know what I'm going to do? I'm going to take the blood pressure cuff over the sleeve. I need for you to do the right way for your test. But in the real world, think about what happens to the patient's blood pressure if they're anxious, if they think they're going to be experiencing pain. And let's be quite frank, sometimes those blood pressure cuffs do actually hurt. So it's like, yin yang. It's like either way, the reading may not be as accurate because this patient's going to be in pain. So I'm going to try to comfort my patient and go ahead and put the cuff on top of the sleeve. But let's say that none of that's a factor because it's a test and it's a perfect world. What you're going to do is you're going to place it directly on the arm. And you would avoid sites that have injury. Let's say it's a scar. If it has a medical device, if it has an IV, you don't want to use that particular extremity without first talking to the patient and then getting the nurse's permission. That's going to help decrease complications, discomfort, and or inaccurate measurements. So always follow the nurse's instructions or the facility policy when you are selecting the arm. And what I normally do is when I go and I introduce myself to a patient, hello, my name is Eunice. I'm your nurse today. I'm here to take your vital signs. Is it okay if I take your vital signs? And now I'm going to go a step further. Is it okay if I use your left arm? Because if someone's had a mastectomy me, I may not know because maybe they have on a jacket and I won't know until the jacket's off, or they could have had reconstructive surgery. And so usually if the person's coherent, they know what their doctor told them, and they're going to tell you, no, you can't use my left arm because of ABC. As a CNA, it's now time for you to relay that information to your nurse, because we may have to put signage over the person's bed or an arm band on their arm, letting other people know that that arm is off limits. Okay, that was a lot of information, but that's what we have to do. We have to teach you so that you can keep our patients safe. Question 14. The most accurate site for measuring core body temperature is it A, rectal, B, radial, C, say the word with me, axillary, not auxiliary. Auxiliary is a cord. Say it with me, axillary, or D, tympanic. All right, so whenever you're trying to get a core body temperature, where do you put the thermometer probe? Yeah, it is A. It is rectal, you all. And remember, you're going to, of course, put the covering, the protective covering, and you're only usually less than an inch. You're not putting a whole probe into someone's rectum because you can actually pierce the intestinal wall, and that will be a perforation. Like literally, you can go through their intestine. So it's just a tip. And rarely have I seen that a CNA or a patient care tech will be performing a rectal temperature. As a nurse, if a person requires a rectal temperature, I have already done so. I've always done so. 15. The CNA counts 108 beats per minute, and we're talking about the heart rate. What should they do next? Is it A, leave the patient and notify the nurse? B, tell the patient to calm down? C, recheck after 1 hour? Or D, notify the nurse? And I'm thinking the differences between A and D is that one, you stay with the patient and notify the nurse, versus A, you leave the patient to notify the nurse. What would be the safest for your patient? Yes, you are right. It is going to be D. So a heart rate over 100 beats per minute, we call that tachycardia. And so that patient could become faint. They may be dizzy if they stand up. So just stay with them until your nurse can get in the room, and go ahead and do the other vital signs too. Just telling me that a patient's heart rate is 108, I need to see the whole picture. So get me a full set of vital signs. But you're going to report those vital signs to the nurse. And then, of course, when I come in, I'll check on the patient. It could be anxiety. It could be pain. It could be that maybe they haven't had their pain, their heart medicines yet. So, but just try to stay with them for as long as possible to let your nurse get into the room. 16. A patient's pulse is described as thready. What does this indicate? Is it A, a strong regular pulse, B, a weak pulse, C, a rapid bounding pulse, or D, an absent pulse? And so the pulse has different characteristics. And so based upon your patient, if they're older and maybe dehydrated, or if they're young and well hydrated, the pulses are going to feel differently. And therefore we use different terminology. And so for 16, if you chose B, phenomenal. So a thready pulse indicates the pulse is weak and may be hard to detect, such as when a patient is dehydrated or they have bradycardia. Their heart rate is really slow. It's going to be weak and hard to detect. 17. Which of the following factors can cause a falsely high blood pressure reading? Is it A, using a cuff that is too small? B, using a cuff that is too large? C, positioning the arm above the heart level? Or D, having the patient sit with legs uncrossed? So which of those will cause a falsely high blood pressure reading? Yes, yes, yes. It is A, you all. Don't put a tiny cuff on Big Tim. If you do so, you're going to compress the artery so much until that extra force is going to cause a falsely high reading. So when you look at the image, the cuff should be centered in the center of the arm. There should be space above and below the blood pressure cuff. If you have a cuff that is too big, you put a big cuff, the one that's for Mr. Tim, on Miss Nancy, you're now going to cause the blood pressure to be low. So if it's too large, the blood pressure is low. If you put a really small cuff on a big person, that extra compression is going to cause the pressures to be high. Plus, sometimes it just pops off anyway. So have the right cuff size for the right patient. Question 18. A nursing assistant notes that a patient is diaphoretic. This term means the patient is it A, sweating excessively, B, experiencing cold chills, C, experiencing shortness of breath, or D, having chest pain? Your patient is diaphoretic. That is right. It is A. They are sweating excessively. So, diaphoresis is the medical term for excessive sweating, often associated with fever, exertion, stress, or hypoglycemia. Whenever the blood sugars start to drop, your body compensates and the patient starts to sweat. And so not only are they sometimes hard to awaken, but they're also sweaty too. And so either way, it's still a medical emergency. But if your patient's diaphoretic, let your nurse know because something's not right. The body is trying to compensate for something that's abnormal within that person's body. 19. Which pulse site is used during adult CPR to assess circulation? Is it A, radial, B, cricoid, C, carotid, or D, femoral? And this one should be easy for you all. So I'm revealing the answer in 3, 2, and yes, it is C, carotid. So the carotid pulse is used during CPR because it is easily accessible and provides a strong indication of circulation. Plus, it's closer to the heart. So it's just going to be easier for you to go here when you're like, hey, are you okay? Just go to carotid pulse. As a reminder, you cannot use your thumb when you're checking a pulse because your thumb has its own pulse. Use 2 or 3 fingers. Evidence says we can use 2 or 3 fingers. I always use 3 to feel for a pulse. You do what's best for you. Question 20. What is the normal respiratory rate for an adult at rest? Is it A, 8 to 12 breaths per minute, B, 12 to 20 breaths per minute, C, 20 to 30 breaths per minute, or D, 30 to 40 breaths per minute? The normal respiratory rate for an adult at rest. We need you to know the normals because you let us know when something is abnormal. Don't let us know everything. Let us know the important stuff. And when you're giving a report to your nurse, lead with the important stuff. Don't be like, well, the temperature's normal and the blood pressure's normal and the heart rate is normal because I'm about to walk off. Lead with what is the most important, the most critical. And so for question 20, the answer is B. A respiratory rate of 12 to 20, that is normal. However, if the respiratory rate is lower than 12, we call that that could indicate respiratory distress. And so that may happen due to medications. Maybe they just came from anesthesia. So if it's less than 12, in my mind, it's too close to 0. So you want to be monitoring. You really want to be counting your patient's respirations and don't just guess and put down that everyone's respiration rate is 16. All right. Question 21. A patient suddenly clutches their chest and collapses. Which is the most likely medical emergency? Is it A, anxiety, B, pulmonary embolism, C, seizure, or D, heart attack? Suddenly clutches their chest and then collapses. What are you all thinking, team? I see some of you all thinking B, pulmonary embolism, but usually that would be more respiratory. Yes, they could have chest pain, but they would have respiratory conditions. They don't usually just pass out and collapse on the ground. So yes, it is D, so it's heart attack. So sudden chest pain and collapse are classic symptoms of a heart attack. Sudden chest pain, that's not usually a symptom that is common in women. With women, we may have back pain, but if something is changing as far as your pain is concerned, you want to get your nurse in the room, of course. But when someone collapses sometimes with a heart attack, they can have arm pain. And so it's like, why would they collapse with a heart attack? Because the heart attack was so severe until it cut off blood flow to the rest of their body. This person could be about to go into cardiac arrest. So get to moving, save your patient, stay there with them until the nurse can arrive. 22. A patient is sweating, has slurred speech, and appears confused. What should you suspect? As a CNA, you don't diagnose, but you need to know what's going on with your patients. So they're sweating, they have slurred speech, and they're confused. Is it A, hyperglycemia, B, hypoglycemia, C, stroke, or D, panic attack? And someone was being mean spirited, and they put online that I teach CNAs as if they're trying to take the NCLEX. And I responded that I teach CNAs who are going to take the NCLEX eventually. So I'm training you up higher. I'm training you so that you would be an asset to any nurse that you work with. And in addition to that, when you get to nursing school, you're not so far behind and you will be able to understand terminology and understand concepts. So I trick you by means of a free CNA class. I trick you and I'm teaching you to move up. You're going to be a CNA for maybe a year or two, but then after that, it's time for you to go further, whether it's LPN, RN, speech therapy, physical therapy, but we're getting you in, we're teaching you the basics. And so if your patient is sweating, they have slurred speech, they appear confused, it did not say that a part of their body was weak. So it is not C. All right. So that means the answer must be B. It is going to be hypoglycemia. So symptoms such as what we just discussed are typical of low blood sugar. Immediate intervention with fast acting carbohydrate is critical. So if you're at a facility that allows the CNAs to do the glucometer checks or the pulse ox, the blood sugar readings, then of course your nurse is going to, once she gets into the room, because you've called her in, you're going to go leave and get that equipment. And then if you're able to do so, you will perform the glucometer reading based off of that number. Your nurse will then determine whether or not that person can have orange juice. If they're a dialysis patient, they can't have the orange juice because of what? That's right, the potassium. So maybe they can have apple juice. So, but if they're unable to swallow because their sugars are so low and it's not safe for them to swallow, your nurse may have to start an IV and give intravenous dextrose. So there are ways for us to get their sugars up. We just need you to notify to actually recognize the symptoms. Question 23, what is sleep apnea? Is it A, a sleep disorder where a person walks in their sleep? B, a condition that makes someone breathe faster when sleeping? C, a condition that causes high blood pressure at night? Or D, a condition where a person stops breathing during sleep? What is sleep apnea? Revealing the answer in 3, 2, and yes, it is D. Sleep apnea causes a person to stop breathing many times during their sleep. It can also cause them to like snore loud. So it's like, and then silence. You're like, is my patient still alive? But this can cause lower oxygen levels and put stress on the heart and the brain. Okay. Let's go to 24. And if I didn't tell you, we're going all the way to 40. So thank you all for being here and studying with me. Question 24. What is an agonal breath? Is it A, fast, shallow breathing after exercise? B, normal breaths during sleep? C, gasping breath that occur during cardiac arrest? Or D, snoring sounds from nasal congestion? What is an agonal breath? And if you've taken the basic life support course, you should know what this is. So revealing the answer in 3, 2, and yes, it is C. When they have an irregular breath with no signs of life, no pulse, you just hear a gasp. That's a precursor to death. You're about to be starting CPR. It's no rhythm. It's no rise of the chest and then the fall, repeated by another rise and fall. It was 1 or 2 irregular gasps. No signs of life. The person's not responding to you. we need for you to go ahead and press that code button to get that nurse into the room and to start CPR, because agonal breaths are a precursor to death. They are not effective breaths and they require immediate CPR. Question 25. A patient reports chest pain that radiates to the jaw. What should you do? Is it A, offer them water to see if the pain subsides? B, notify the nurse immediately? C, administer aspirin without checking protocols? Or D, ignore it as it might just be heartburn? And this one's super easy. You all know the answer. Of course, it is B. Get that nurse in the room. You all cannot give aspirin. So, as a CNA, even though that is something that's over the counter, even if you're in home care, you could hand your patient the pill bottle, but you could not physically pick up the pill, hand it to your patient unless you've taken a medication tech class. And right now, you've not done any of that because you are a CNA, or at least you're a candidate to become a CNA. So you cannot administer medications. You have to get your nurse in the room. If you're in home care, that means you have to get EMS there. And if the dispatcher tells you to give the aspirin, well, then you're somewhat covered. But I would still just hand the patient the bottle and tell them what to do with the aspirin. 26, a patient has cold, pale hands, and a weak pulse. Excuse me. What could this be a sign of? Is it A, the room is cold, B, good circulation, C, a fever, or D, poor blood flow or perfusion? And I know as a nurse, as a caregiver, we'll say, oh, cold hands equals a warm heart. That's not the case with your patients. Cold, pale hands and a weak pulse, it indicates that something's wrong. It would be D. You all, they have poor perfusion. Let's try to warm those hands up. Let's figure out what's going on. And remember, if someone has poor perfusion and you try to put the pulse ox on their finger, you're not going to get a waveform. So you're not going to get an accurate reading. 27. What does cyanosis look like in a fair or light-skinned person? Is it A, bright red cheeks, B, blue lips and fingernails, C, warm pink skin, or D, yellow eyes? What does cyanosis look like in a light-skinned person? Great job, team. Yes, it is B. So in light-skinned individuals, cyanosis appears as a bluish color, the lips, the fingers, or toes due to lack of oxygen. 28. Which of the following is a sign of a respiratory emergency? Is it A, high-pitched wheezing, B, sneezing and mild congestion, C, rapid breathing after exercise, or D, yawning frequently? A sign of respiratory emergency. Yes, imagine. I heard my son doing this once. I heard like this odd sound. And I'm screaming, are you okay? And he didn't respond. That told me that his airway was partially obstructed. So the answer is A, a high-pitched wheeze. You hear this abnormal sound coming out of your patient. Go and check, because they could be having an asthma attack or they could have an upper airway obstruction. Fortunately, my son was able to clear his own obstruction, but you always want to ask people, are you choking? Because if they nod and indicate yes, you would have to perform the emergency technique that I'm not going to give you the answer to right now, because something tells me you're going to see it on a future test question. All right, let's go to question 29. What does cyanosis look like in a dark-skinned person? Is it A, blue lips and fingernails, B, pale white skin, C, gray or ashen lips, tongue, or gums, D, bright red cheeks? What does cyanosis look like in a dark-skinned person? So when you think dark skin, just don't think African American. Could be a person who is from the islands. It could be Caribbean American or from the Caribbean period. It could be someone who's from the Middle East. It could be someone who is Latino, Hispanic. So whenever the textbooks are giving information, I'm finding that it's not always as inclusive. For example, they'll say that redness is a sign of a stage 1 pressure sore. I've not seen my Black patients turn red. They've had pressure sores. It's usually discoloration. So I want you to be those caregivers who think outside of the normal, European standards. I want you to think about all patients because we have to take care of all of them, and our textbooks need to be more inclusive. All right, and with that being said, the answer is going to be C. It is so odd, you all, to walk into a room and to see somebody who was brown now be like this grayish color. But I need to let you know, we usually do not turn blue. It can be like purple. It's going to be a discoloration. But in dark skinned people, cyanosis may not always appear blue. Instead, look for gray, ashen, or dull coloring in the lips, gums, or tongue. So what you see there in this image, the fingers, this color is mottled. Well, I call that mottled, not necessarily blue. So mottled, that mottled appearance, you'll see that oftentimes too, regardless of race. And so that is referred to as peripheral cyanosis. Question 30. What is the first action when a patient experiences a seizure? Is it A, hold the patient down to prevent injury? B, insert a tongue depressor to protect their airway? C, move objects away from them and protect their head? Or D, attempt to give them medication orally? Right, so you walk into your patient's room, your patient who was sitting in a chair has now slid down to the ground and they are seizing. What is your priority? Notice none of the responses here. I did that intentionally. Say notify the nurse. Because the first thing I need you to do is to get to that patient and do C. Move those objects out of the way. Protect their head. Put a pillow, your hands, their heads hitting that ground. And now you're screaming out for the nurse. So sometimes to get the nurse, you can't always hit that panic button. My patient is here and the panic button is there. My patient is seizing over here and hitting their head. Let me protect my patient and scream out, nurse, nurse, nurse. Someone's going to come to you. I need help right now. Protect your patient. If they're seizing in the bed, sometimes they're thrashing about. Their arms can hit the side rails. Start patting those rails. Usually after the seizure, they're hard to awake. We'll put them in the sideline position, the recovery position. That also helps to maintain a clear airway in case they vomit. Hopefully the vomit will come out. But during the seizure, your priority is preventing the injury. Don't insert anything into their mouth. They're not going to swallow their tongue. Get your nurse in the room. And then also don't forget the time. So when you walk in, I know it's going to be hard. Look at their clock. You see them seizing, you're holding their head, look at their clock, because we need to know how many minutes, how many seconds that seizure actually occurred. Question 31. What is the best time of day to weigh a patient? Is it A, at night before bed, B, randomly during the shift, C, after meals and baths, or D, in the morning before meals and after toileting? Again, thank you all for being here and studying with me. I'm going to try to shoot another video on Sunday. That is my goal. But more than likely it's going to be on CPR. It's going to be on another topic, not CNA. So, but still tune in because it's still great knowledge. We do train across professions, and so not all of our videos will be on CNA. So I know you all love the CNA videos, but I have to also train my other babies up too. All right, so for question 31, the answer is D. So weighing patients in the morning before meals ensures consistency and avoids weight changes that will be influenced by food or waste. Remember, if this is 16 ounces of water and I drink this is a pound. And if I haven't used the bathroom, that means that I have a pound of extra fluid. And so it's going to appear as if I gained weight when I didn't. It's just that you took my weight without me having an empty stomach and with extra fluids within my system. Question 32. A patient complains of severe abdominal pain and passes black tarry stools. What does this indicate? Is it A, dehydration, B, internal bleeding, C, constipation, or D, food poisoning? Yep, you have it. It is B, internal bleeding. So black tarry stools indicate bleeding in the gastrointestinal tract and require urgent medical intervention. Question 33. What is the priority when a patient appears to be choking and cannot speak? Is it A, perform back blows, B, offer water to drink, C, perform abdominal thrust, or D, call the doctor? Revealing the answer in three, two, and yes, it is C, perform abdominal thrust. And so the term that you hear a lot would be the Heimlich maneuver, but because of copyright and the family suing, we don't usually say that term anymore. So we're going to perform abdominal thrust. If a patient cannot speak or breathe, you're going to do that technique in order to ensure or at least try to assist them in clearing their airway. 34. Which symptom is most concerning for a diabetic patient? Is it A, watery eyes, B, fruity smelling breath, C, fatigue, or D, mild thirst? All right. I see some varying answers coming through, revealing the correct response in three, two, and it is B. Once you smell it once, you will know exactly what we're talking about. It is fruity smelling breath. And so that represents ketoacidosis. Their blood sugars are high. So that is a life-threatening complication of diabetes requiring urgent care. You smell that fruity breath? Let's do some blood sugar checks. Let's check the numbers, and I'm sure their sugars are elevated. Question 35. What is the immediate priority for a patient experiencing a suspected stroke? Is it A, check their pulse and blood pressure, B, start CPR immediately, C, notify the nurse, or D, ask the patient to drink water? So we think that your patient's having a stroke. Remember those symptoms fast. Face is asymmetrical, so they have facial droop. Their arms, they can't raise their arms. Speech is slurred. T, time to do what? Yes, we would say call 911, but if you're in a facility, you're going to do C. You're going to get that nurse in there. We're going to get that stroke team in there because time is critical in stroke care, so rapid intervention can minimize brain damage. Question 36. A CNA takes a blood pressure and gets a reading of 80/60. What should they do next? A, recheck the blood pressure and report to the nurse. B, ignore it because it's close enough. C, write it down and tell the patient not to worry. D, assume the cuff is broken. All right, 80/60, you all. Yeah, that's low. So you're going to, we go re-verify just in case the machine was broken. You can use a different extremity. You can try again on that arm if that's the only arm. But after you check twice, and we're talking about a few seconds apart with our patient appearing normal. If the blood pressure is 80/60 and your patient is not responding to you, you don't have to recheck. Go ahead and get your nurse in the room. But it depends on how your patient is presenting. Always verify normal readings and then report them. Low blood pressure may indicate shock or another emergency. Question 37. Which symptoms suggest a potential overdose? Is it A, rapid speech and increased activity? B, increased urination and thirst? C, sudden rash and itching? Or D, shallow breathing and pinpoint pupils? All right, we're suspecting an overdose. Yeah, so when you see us, we go in the room, we're doing sternal rubs, and we open up those eyes. We're opening up those eyes to see if it is D, if they have pinpoint pupils. And so the arrow is pointing to the pupil that looks like the tip of a pin, pinpoint. So pinpoint pupils and shallow breathing are common signs of an opioid overdose, requiring immediate administration of Narcan by the nurse if available, and emergency care. Question 38. What should a CNA do if they're unsure about a vital sign reading? A, record it anyway. B, round the number up. I absolutely hate when you all round the number up. If all your numbers end in 0 and your blood pressure is never 142/84, You don't know what you're doing. Stop rounding up, stop rounding down, okay? Do you want to do C, ask another CNA to record something similar, or D, recheck it or ask for help before documenting? That's right. It's okay to ask for help. It is D. Learn how to do it to keep your patient safe because accurate documentation is crucial. Question 39. A CNA documented that a patient was resting comfortably during their shift. However, at the change of shift, the patient was found pulseless, cold to touch, and clearly deceased. This patient was dead. What could the CNA potentially be charged with? Is it A, abuse and battery, B, negligence and falsification of documentation, C, practicing medicine without a license, or D, theft? Yeah, stop documenting that people are resting comfortably. You can go in, you're like, hey, there was, make sure the chest is moving at least. So it is B. All right. So if the CNA documented that the patient was alive and resting when they were actually deceased, this could be considered negligence. And falsification of documentation, a serious legal and ethical violation. Remember, your job is to protect your license. My job is to protect my license. So if you don't tell me something was abnormal, I'm going to assume this patient is okay. So when we tell you to do those hourly checks, you're not just checking to see if their feet are still in the bed, if they're under the blanket. You pause, you stop, you watch for chest rise, and that's going to tell you whether or not your patient is alive. Not all of your patients will be on the heart monitor. So CNAs are responsible for reporting changes and ensuring that what they chart is truthful and timely. Question 40, you all. Which of the following is the most accurate method for weighing a patient with bilateral leg amputations? Is it A, using a standing scale and guess the rest? B, use the average weight for their age and gender? C, ask the patient's family for past weights? Or D, use a sling scale or bed scale? All right, that's a no-brainer. All right, if they are a double amputee, we can't put them on a standing scale. Some they do also have wheelchair scales too, by the way. But this one right here, the answer is going to be D as in dog. So patients without legs should be weighed using a bed scale or a Hoyer lift scale to ensure accuracy and safety. And guess what, team? We did that. So remember, caring CNAs make caring nurses. And if you need CPR, CNA, you want a hands-on class, IV therapy for nurses, or Boss Nurse Academy, you all go to fltraining.com. I have my personal website, but the business's website is fltraining.com. And you're going to help us reach that goal of 1 million YouTube subscribers. That's going to happen this week because of our friends like you. So thank you for watching. It's time for me to go to the office and have a wonderful day and a wonderful rest of the week. I love you all. Stay prayed up, be blessed, and I'll see you in the next video.